Last but not least, we have our colleague Christina Athanasopoulou, which is an associate lecturer from the medical school, Aristotelian University of Thessaloniki. And Christina is going to present the learning by teaching in dental informatics, an explorative study in a different area than medical informatics, I suppose. Christina?
Thank you for the introduction, Steriani. Good evening, dear colleagues. Let me add to the affiliation that I teach dental informatics along with Professor Bamidis, and this is how this paper is related to my employment. Earlier today, I was happy to attend Christina Ranji talking about the importance of teaching capabilities for higher education, because the motivation behind adopting a new pedagogical approach was simply the wish that every inspired and effective teacher more or less has to get the students involved in the course and gain much more than plain knowledge that will be forgotten right after the exams. The truth of the ancient phrase, through teaching we learn, is something that often a teacher experiences. Of course, there are differences between what an experienced teacher gains through teaching and what a naive learner might gain through this procedure, but the basic principles behind it are the same. So we can say that social learning theories and developmental psychology form the theoretical framework that indicates that learning by teaching can be an effective pedagogical approach. At the course of dental informatics, there are two more features that argue in favor of this method. The first one is that the course is expected to enhance learning, research, and inherent skills, and to introduce aspects of field learning and lifelong learning. And what a better way to do that than to get the students involved and practice these skills towards a specific goal, instead of just showing aspects of these areas. And the second one is that due to technology rapid changes, it's more important for the students to have the confidence and the ability to search for and learn how to use the latest dental informatics applications by themselves when they will need them, instead of being introduced to the current ones that will be out of dated. So the aim of this study was to explore the possibility of applying learning by teaching in dental informatics and to identify the best practices in various aspects towards the optimum implementation, as the time schedule, whether to work in groups or individuals, and how we're going to assess their performance. The course of dental informatics is elective, and students may attend it from the first to the fourth year of their studies. 29 students formed 4 groups, depending on the year of the study, and that's why the number of participants varied from 5 to 10. The students were asked to prepare a short lecture to supervise part of a lab exercise or to create a virtual patient using the Open Labyrinth platform, the one that was introduced at the previous presentation. So the time schedule that we followed and that we practically saw that it's working and we are thinking to keep it that way, is that we explain the procedure and announce the topics to be taught by the students, during the first couple of weeks, and then we gave them 1 week to form groups and choose a topic, 2 weeks to research and come up with an outline. 1 week was for interacting with them face by face, because all the time we were interacting through emails and forums, and to give them all the useful and necessary guidance so they're at the correct path. Then they had 2 weeks for the preparation and 1 week for, again, interacting with them and assess their job. Actually, we asked them to give, to do a bit of a rehearsal in front of us so we can assess the content and the presentation of their work. And then we had 1 session per 4 lectures or labs. So depending on the number of students, one must consider a number of sessions. Now, learning by teaching can be regarded in two distinct but interconnected phases. First, there is the preparation, which is related to teaching expectancy. During this phase, the student tries to understand thoroughly the subject in order to be able to explain it to others. This attempt usually involves reformulation and codification of the material, which leads to deeper understanding. As the students mentioned themselves during the focus group sessions, learning for the capability of explaining to another student shifts learning away from just memorizing the facts with no context. As you can understand, I have inside quotes just parts of the students' comments during focus group sessions. The student teachers revise feeling the responsibility of the teacher to succeed, so that his or her students do not fail. Hence, they take the necessary steps to resolve any possible misunderstandings, whereas during a usual study procedure, they just ignore them and go to the next step. Now, the second phase of learning by teaching is the actual act of teaching, during which internal and external stimulation may raise awareness of possible conceptual gaps and lead to the reorganization and clarification of the material. Actually, the verbalization itself clarifies thinking and reveals weak points, as one of the students quite clearly put it. Now, of course, there is a possible drawback, the one of anxiety induced by an audience effect. But our students said that this anxiety was equal or less than the one they get from exams. So it was okay for them. As I mentioned, there were 3 different types of course that the students were assigned to. And naturally, there were many qualitative differences that are caused by the differences between lecturing and labs and virtual patients. So the students mentioned during the focus group sessions some of these aspects, and these ones were from the perspective of the ones responsible for the lab exercises. They were actually happy to be responsible for labs and not lectures. And they said that they think it's more direct and the feedback is more sincere, because during a lecture, someone may just fake that is understanding. During a lab exercise, the students must understand them in order to continue with the exercise, so they get an immediate and sincere feedback. And some of them actually quote the third one, that they felt confident and proud and like a dentist, like it was the first time that they felt like, achieving something. These ones are from the students that were responsible for creating educational objects, virtual patients. And they say that although they chose topics for the virtual patients that concerning knowledge that they already had, in order to create a virtual patient, they had to clarify and codify this knowledge. And this also concerns critical thinking and consideration of every possible aspect in order to create the labyrinth and not just have a direct path. And they said that they felt like it was really helping them clarify all this vague knowledge that they got from other sessions. And again, they said that they were really proud to have a really virtual patient working. And I should mention here that the virtual patients were not just available online. But the rest of the students were asked to go through them during a lab session in order to observe the reactions and get feedback. So the students that created these objects actually saw the reactions of the other fellow students. Now, when applying learning by teaching, one aspect that we should consider extensively is the response of the students to the student teacher, because it's not only what the student that will play the teacher will learn, but also what the students that will be the audience will learn. Because I think I haven't mentioned that. All the material that the students had to present was actually part of the lesson, was not something additionally, as sometimes as part of lessons, the teachers ask the students to present something that is not that much important for the lesson. This material that the students had to teach was actually part of the lesson. And they said that as students, as attendants, sometimes they paid even more attention to the fellow students out of curiosity or fellowship. But on the other hand, they said that they feel a lecturer has more prestige, so they wouldn't trust a fellow student to teach them something that is basic for the dental knowledge. So for the dental informatics, it was okay, but for basic dental courses, they will probably not accept it. Just a small comment on that. Perhaps this has also to do with the fact that this method is quite new. So every new thing has to pass through some phases in order to be accepted. Now, regarding the perception of the teacher's role, because sometimes when you ask someone to undertake a role, you might have negative results as well. But in our case, it was positive ones. The students actually realized how much work, effort, time it takes to prepare a lesson. And since they were, they wanted the others to pay attention and participate to their lecture, they will try to do it in the future and attend more carefully what a lecturer has to say. We evaluated the students' performance orally. The final grade of each student comprised of a grade for the content and the presentation fulfillment, and one for their performance at the lab exercises, because they had to take some labs, some of which were introduced by the tutors, and some of them were introduced by fellow students. Well, the learning gain for a student teacher is a considerable one. We noticed a major improvement between the first interaction and the teaching session, and there were major qualitative differences among phases, both both concerning the material and the other skills that I mentioned that we expect the students to gain through this course. The learning gain for the student was assessed for the lab exercises and the virtual patients, and it was the same, the performance had the same average as the previous year. So of course, they were different students, but statistically you can say that it's more or less the same. So it was not affected negatively by the fact that other students were teaching. Here we come to perhaps a weak point, that the lectures were not assessed in a direct way. And as Dr. Tops mentioned in at his keynote speech, perhaps assessment is often a problematic aspect. So the the gain from the lectures that were taught by the students were not actually assessed. We just evaluated the students themselves, the students' teachers themselves, and then just noticed how the fellow students react and whether there were questions and etc. So the overall perception of this method is positive. We believe that it's a great method to increase learning, research, and internet skills without having designated sessions for this that sometimes are boring, because what's usually happening with technology is that students have different different capabilities. So it's not very easy to have a specific session for introducing internet platforms. One drawback is that this method is quite time-consuming for both lecturers and students. It takes, like the whole week to interact with them, twice at least for each semester, and a lot of time for forum, email replies, etc. And the students also felt that lectures and virtual patients required more time and effort, while they focus on a small part of the curriculum, and they said that they will definitely not be, they will definitely not accept it if they also had to take exams, along with having this method for assessing them. On the other hand, the labs can achieve the goals without overloading the students. And we think that perhaps it's the optimum choice for such a lesson, such a course. So the next step, we are thinking to, we are actually planning to have 5 groups. One that will be used for control, as a control group, that will be just self-study, reading for the purpose of being examined. The second one, study to teach. The third one, study and actually teaching. What we want to evaluate between second and third group is the effect of teaching anticipation versus the actual act of teaching. And then we'll also have one group that will be taught by students and one group that will be taught by instructor in order to evaluate the learning gain. And for assessment, either written or oral exams, depending on whether it will be a lecture or a lab exercise, as we are thinking. So thank you for your attention.
Thank you, Christina, for your interesting presentation. Any questions or comments for Christina? Yes, please.
Thank you for your interesting presentation. What was inclusion criteria for these research groups? I mean, students were included in research as teachers, including in research by their wish or somehow in another way?
No, actually all the students that chooses to attend this lesson were participating in the research.
Yes, but by their wish, or it is part of their program to teach another students.
No,
other students.
It's not a part of their curriculum. It's just something that we tried to introduce in order to see the results and see if it's effective or not.
Yeah, that's why I ask this question.
Perhaps I didn't give the overall picture. There were the usual lectures given by myself and Professor Bamidis.
Yes.
There were labs where one of us supervised.
Yes.
But a part of the curriculum was taught by the students.
By the students. And
yes.
How you select these students? By their wish?
Was it obligatory?
It was obligatory.
All the students, it was obligatory for all the students that...
That's why we see these results,
obligatory teaching experiment.
Yes, because this is the results. Because also our institute have experience, 25 years, yes, Athanasopoulou experience teaching 5-6 years students are teaching their first, second year students, but it is by their wish. And the results are very good. You see, maybe it is also that you will think in future.
Can I ask you, when you say the results are good, are they good for the first year students
yes.
or for the
for both of them?
For both of them.
For
yes.
both of them. That's why I ask,
yes,
because
okay.
maybe one group will be by
all materials, and the younger is really studies this material.
Mm-hmm.
It is not obligatory for both of them, you see?
In our case, it was obligatory.
Yeah.
It was just a small part of the curriculum, not the whole thing. But I think there is there are many common let's say, principles between these two cases, but there is a difference. One difference is that the students are teaching fellow students of the same level, in our case. So it's not something that, you know, the experienced students already know and they don't have to learn something new in order to do it. In our case, instead of giving them something to read or introducing this during a lecture, we said to them, you have to find out yourself, and not only find out, but also teach it to others, being able to explain to others. Yeah.
I have to mention that we had very similar results in another university, in a master field about e-health policy issues, and the results were quite the same. The main problem was that this method was time-consuming for the students.
It's very time-consuming.
But I have also to ask something else, that it was noticeable that the students didn't like to apply this method to the core dental courses. So do you think it is worthwhile to apply this method in the first years of the maybe core dental courses?
There are two aspects to that. One is that, as I mentioned, the dental informatics is expected to enhance learning, research, and internet skills. So by this method, we actually give them the opportunity to practice these skills instead of just having special designated sessions for that, which is not the case for the dental core lessons. And the other thing is that usually the dental core courses contain a lot of theory. So if they spend weeks preparing just a part of it, then they will not have the willing and the strength and whatever to just go through all the other curriculum for that lessons. At least this is what they told me. I'm not a dentist, I'm electrical engineering myself. But they said that they had, you know, like huge books that they have to study. And they say that we cannot spend weeks preparing for just a few pages. So.
Okay. Thank you. Any other questions or comments? Okay, thank you, Christina.
Thank you.
And hope the best for the next phase of this method. So that was the last presentation of our session, and I hope it was interesting for all of us. And now I think that Mr. Bamidis will call for the next session, which will take place